Hello everyone. So in this session I am going to describe the abdomen clinical anatomy MCQ questions. So targeting for the INICT 2021 examination. Myself Dr. Mona Lisa, and let's start with the session now. So before starting the session, a brief introduction about myself and about the platform of Unacademy. So I have done my MD Anatomy from Armed Force Medical College, Pune, and this is my code. ANAT10 is my unlock code. It is also the referral code which can be used by you if you want to take the subscription of Unacademy. So I have done my MD Anatomy from Armed Force Medical College, Pune, and I am the educator of anatomy subject on the platform of Unacademy. So for free live sessions on the Unacademy platform, what you can do, you can download the Unacademy app, and thereafter you can find the goal as the NEET PG, and thereafter if you are the user for the first time and you have downloaded the app for the first time, so you have to use the code unlock code ANAT10. You can use this and unlock the free sessions on the Unacademy platform. So my dear aspirants, I would like to tell you about the free sessions. So for free sessions of on the platform, what are the benefits? It's an interactive session where you can interact with the top educators of Unacademy platform. Polls are conducted and you can participate in the poll. Raise your hand and get your doubts clear right itself in the live session. Never miss a session. For example, if you start seeing my session, for example, any of the educator, you start seeing the session, thereafter you can follow that educator and you will get notification regarding all the sessions taken by that educator. So after completion of the session, you can also download the PDF notes. Anytime, anywhere, read from the top educators of Unacademy platform. I also want to tell you about the plus subscription. What are the benefits of the plus subscription? So many times special free sessions are there. Always the link is provided in the Let's Crack NEET PG platform and also the platform of the Unacademy INICT Telegram group and NEET PG. So there you will get the link of all the sessions, and also I display in my session what are the plans for the future classes. Now assess live and recorded version in the plus session. Along with it, you can study from the top educators in the medical stream. On the platform of Unacademy, all 19 subjects will be studied in a very systematic way. So complete live tests and quizzes, study on your device of choice. More than 25,000 MCQs are there, which is also having a detailed explanation for each and every MCQs, which is given by the top educators of Unacademy platform. So also with 1 year and more of subscription of Unacademy, you are getting notes. So that is again a add-on process. So you can take the subscription and you can use my code ANAT10 for 10% discount. So let me also tell you about the Iconic subscription, where the benefits of Prep Ladder is add-on on with the benefits of Unacademy Plus course. So already I have told you about the benefits of Unacademy platform. So when I am talking about the benefits of Prep Ladder, you get the clinical and integrated essentials, video lectures from the dream team. QBank 3 can be assessed with active guidance, tags and more. Rapid revision and snapshots, treasures and dream notes of the Prep Ladder team. So don't miss the opportunity. You should go for Iconic subscription if your target is NEET PG or INICT examination. Also, I want to tell you that updated and highly effective QBank is there on the Unacademy platform. As I told you, more than 25,000 clinical MCQs of all 19 subjects with a detailed explanation based on the latest exam pattern. Use the code ANAT10 to get 10% discount. Now, I also want to give you the information of NEET PG Comeback that is happening on 10th of October, 11 am. So just enroll in this because it's a pool of scholarship from 1 crore rupees. Get enrolled by using the code ANAT10, and till 200 ranked students will get the free scholarship. So avail this opportunity and do participate in NEET PG Comeback. All the best, students. Now, also I want to tell you that as we know that there is also monthly free grant test which is targeted for INICT. So just grab this opportunity and don't forget to give your best in this. So 2 to 3 p.m. 200 MCQs, and 17th October, that is Sunday, is the day when this grant test is going to happen. So just use the code and do participate for this monthly free grant test targeted INICT examination. Also, I want to congratulate the top educators or the top students and the learners who had targeted this year exam, that is NEET PG September 2021. So just I want to congratulate them, and this is all done by the their all dedications, and I am very glad to share their photos on the screen. So these are the top educators of Unacademy platform. So all the best to them for their future tenures. Also, I want to tell you about the batch course which is starting from has started from the 6th October, that is FMG batch, Mission INICT 2021, Target NEET PG 2022, clinical case and discussion batch. So these all batches are there on the platform of Unacademy. So do avail this opportunity, take the subscription, and all these batches is containing both live and recorded version. PDF notes is there, structured batches is there, grand test is there, integrated clinical approach to the subject is there, taken by the top educators of Unacademy platform. So use the code ANAT10 and take the subscription of Unacademy. So before starting this session, I also want to tell you that I have taken this slide where the comparison of NEET PG subscription with the Iconic subscription has been done. So I would like to tell, if you are the students of first or second year, just go for 3 to 4 years of subscription. But if you are the students of final year interns, you can take 1 or 2 years of subscription. So just go for Iconic if your target is NEET PG or next, or otherwise you can take the plus course subscription also. All the best, keep studying. So let's start with the session. Now let's start with the first MCQ. So I would like to read the MCQ for you. During a scheduled laparoscopic cholecystectomy done for a 47-year-old female patient, the resident accidentally clamped the hepatoduodenal ligament instead of cystic artery. Which of the following vessel could most likely be occluded in this iatrogenic injury? Okay, so the options are superior mesenteric artery, proper hepatic artery, splenic artery, common hepatic artery, or inferior vena cava. 5 options are there and you have to mark the correct answer. Okay, the key points which is mentioned. So once again, I would like to just target the key points. So here the key points is cholecystectomy is performed in the patient. Accidentally, the ligament which is clamped is hepatoduodenal ligament instead of cystic artery. So we have to tell that which artery is occluded in this iatrogenic injury. So options are superior mesenteric, proper hepatic, splenic, common hepatic, and inferior vena cava. So my dear students, the hint is already provided and I would like to approach for this. So let's see, this is the option provided. So let me discuss each options nicely. So these are the 5 options which is provided, and the correct answer is proper hepatic artery. Now why proper hepatic artery is the correct answer? So firstly, I would like to give this explanation why proper hepatic artery is the correct answer. Actually, the ligament which was targeted in this operation was hepatoduodenal ligament, and we know that proper hepatic artery is one of the structure which is lying in this ligament, hepatoduodenal ligament. So it will be occluded. So when the content of hepatoduodenal ligament is there which can be clamped, so the proper hepatic artery can be injured. So proper hepatic artery is lying in the hepatoduodenal ligament and it will be occluded in this condition. Okay, the artery actually lies in the free margin of the, it is lying in the free margin. As we know, it is the artery which is located in the free margin of the omental foramen, and it is lying very close to foramen or Winslow, which is forming a communication with the greater and the lesser sac. So this artery is lying within the right free margin of the lesser omentum. So that is the reason. So this is the reason that proper hepatic artery will be occluded. So that is the reason. I will show you the diagram also, don't worry. Okay, so once more, if you will see hepatoduodenal ligament. So hepatoduodenal ligament is the part of lesser omentum, and in this ligament the structure which is residing is 3 structures: hepatic artery proper, the bile duct, and that of the portal vein. So the artery which is involved here will be the proper hepatic artery with no doubt. Okay, that is definitely clear. So it will be occluded because it is clamped in this operation. Now why the other options are not the correct? So this is the right option. Now superior mesenteric artery is the wrong option. Why it is the wrong option? The reason is that superior mesenteric artery is a branch of abdominal aorta. It's a direct branch of abdominal aorta, which is a ventral branch, and actually when we are talking about the location of superior mesenteric artery, it is lying inferior to hepatoduodenal ligament. Okay. So actually proper hepatic artery is lying in the right free margin of the hepatoduodenal ligament, but when we are talking of superior mesenteric artery, it is lying inferior to hepatoduodenal ligament. It is lying inferior to hepatoduodenal ligament. So this will be the wrong option. So definitely this will be the wrong option. Now splenic artery is also the wrong option and it is not correct. The reason is that splenic artery actually is running posterior to stomach. It is lying in the posterior relation of the stomach, in the stomach bed. So it is also not exactly lying in the hepatoduodenal ligament. Now common hepatic artery. Common hepatic artery is also not the right answer because common hepatic artery is ultimately giving the proper hepatic artery which is occluded. So this origin is also not involved. Inferior vena cava is actually not the right answer because we know that this free margin of the hepatoduodenal ligament and it's communicating via foramen of Winslow, and that communication is between greater and the lesser sac, and posterior to that of foramen epiploic foramen or foramen of Winslow inferior vena cava lies. So I will show. So it is lying posterior to it, so it is also not getting clamped. So the structure being clamped is proper hepatic artery. Now let me show you this diagram. So I am just enlarging this diagram. So now you can see which all structures are lying in the hepatoduodenal ligament. So here very nicely you can appreciate three structures as I told you: common bile duct, portal vein and hepatic artery. So in this relation also actually you can see this is the lesser omentum, and the lesser omentum has got two parts. One is the hepatogastric part and the hepatoduodenal part. In the hepatoduodenal part and posterior to it lies the epiploic foramen. Okay, so in the right free margin of it, what you can see, the three structures are residing, in which common bile duct is lying slightly right, the portal vein will lie posterior, and anterior structures are proper hepatic artery and common bile duct, and it lies, the bile duct is slightly lying towards the right hand side. So this is the relation. Now let me show you another diagram where you can see the reasons. Okay, the three structures very nicely. So here you can see correctly HA. What is this HA? This is the hepatic artery proper. So hepatic artery proper is injured when the clamping is done of the hepatoduodenal ligament. Portal vein is lying posterior and bile duct is lying onto the right side, anterior and to the right side. So yes, we are clear with this. Now let's move on to the other diagram. Here I want you to show the relations of epiploic foramen. So as I told you, epiploic foramen, which is also called as foramen of Winslow, it's forming a communication between greater sac and the lesser sac. So here why I have struck the inferior vena cava as the wrong option, because it is lying posterior to epiploic foramen. Okay. Now in the free margin of lesser omentum, three structures residing, that is the hepatoduodenal ligament, which can be injured. So clamping is done and these three structures has been shown: bile duct, hepatic artery and portal vein. Superiorly lies the caudate process of the liver and inferiorly lies the first part of the duodenum. So done with this. I think this explanation is clear to you. Okay. So yes, so that is the reason that B is the correct answer. So let's move on to the next MCQ, that is MCQ number 2. Okay. A 45-year-old man enters the emergency department with a complaint of severe abdominal pain. During physical examination, it is observed that his cremaster reflex is absent. Which of the following nerve is responsible for the efferent limb of cremaster reflex? Whether it is ilioinguinal, iliohypogastric, genitofemoral, pudendal or ventral ramus of T12. So we have got 5 options and we have to choose the correct answer. Now the key points which is mentioned, so most important point is that we have to know the nerve which is the efferent limb of cremaster reflex. So this is the clear question which is directly asking about the efferent limb of the cremaster muscle, and in this case the direct answer will be genitofemoral nerve. Genitofemoral nerve. Actually so I will also rule out the incorrect option. When I am talking about genitofemoral nerve, it actually is arising from the ventral ramus of L1 and L2. It is giving two branches, one is the femoral and other is the genital. Femoral branch will supply the skin over the femoral triangle, and genital branch will go to traverse towards the spermatic cord, scrotal skin, and also give innervation to that of cremaster muscle. So this genital branch of genitofemoral nerve is the efferent, it is the efferent limb of cremaster reflex. So this is the reason it is the correct answer. So I will then explain and rule out the other incorrect option, and then I will just show you a diagram explaining the afferent and the efferent limb of cremaster reflex. So yes, So please write on this point. The genitofemoral nerve originates from, so what is the origin point? It arises from the ventral rami of L1 and take contribution from L2 also, L1 and L2. It gives two branches, one is the femoral branch and the other is genital branch. Now, if I talk about femoral branch, the femoral branch is supplying skin over femoral triangle. What about the genital branch? So when I am talking about the genital branch, so it, in case of males, I am telling it is traversing through the spermatic cord. It will traverse along with the spermatic cord and will supply cremaster muscle and the scrotal skin. Now, so we have got the correct answer. Now coming to the options which were provided. So this is clearly that option C is the correct answer, no doubt about that. Now what about the other option? The other options which was given, so one by one I would like to rule out. Ilioinguinal nerve. Why ilioinguinal nerve is a wrong option? Actually, ilioinguinal nerve arises from the root value L1 and in case of males it is supplying the upper part of the scrotum and also the root of penis. Exactly, it is not forming any kind of efferents for the cremaster reflex, so it is not the correct answer. Iliohypogastric, when I am talking, probably it's also root value is L1, sometimes it take contribution from T12 also, and actually it is supplying the skin of ilioinguinal nerve is also supplying the skin over scrotum and root of penis, and iliohypogastric is supplying the skin of hypogastric region of anterior abdominal wall. Hypogastric region and also anterolateral area, anterolateral regions, and also few of its twigs goes to gluteal region also. Pudendal, so it is also not the right answer. We know that pudendal nerve is actually giving innervation to external genitalia in case of males and females, and it is not giving any innervation to cremaster muscle. So it is actually giving innervation to external genitalia, but it is not giving innervation to cremaster muscle. Okay. So this is also the wrong option. Now coming to the next, that is ventral ramus of T12. Actually ventral ramus of T12 is giving innervation to lower anterior abdominal wall. It is giving innervation to lower aspect of anterior abdominal wall, and it is also giving innervation along with the iliohypogastric nerve. So it is giving the innervation along with iliohypogastric nerve, and it is not giving any contribution to that of cremaster reflex. So again, this is the reason it is the wrong option. Now my dear students, let me explain you about the cremaster reflex, but you must want to know the afferents and efferents both. In the MCQ, directly the efferents was asked. Now when I am talking about cremaster reflex, it's a reflex which is initiated by lightly, as you can see here, the stroking of the skin. So medial aspect of the thigh and superficial medial aspect of the thigh region is stroked in a downward direction. So when I am talking about a normal reflex, what will happen? There will be cremaster muscle contraction and it will pull up the testes and the scrotum. So this is how the test is performed. So this is the diagram showing cremaster reflex. Okay. So in case of cremaster reflex, the reflex is elicited by lightly stroking, as you can see in the diagram, which part is stroking in downward direction, superficial medial aspect of thigh as in downward direction. This is the process how it is performed. So what will be the normal output of the reflex? So when I am talking about the normal reflex, what you can see, the response is initiated by the contraction. So there will be contraction of, so normal reflex mein kya hoga, there will be cremaster muscle contraction. This will lead to the pulling up of the testes. This will lead to the pulling up of the testis in the scrotum. So scrotum testis is pulled upward. So this is how the normal cremaster reflex is performed. Okay. So now showing you the other diagram where you can see the afferents and the efferents. So the first thing is what I want to actually the genitofemoral nerve. So actually as we know, the genitofemoral nerve, genital branch is the efferent and its femoral branch is the afferent. So see here, this is how this is arising. As you can see, genitofemoral nerve, we have already seen the genitofemoral nerve arises from L1 and L2, and that is clearly shown in this diagram, L1 and L2. So this is the source which is shown. Okay. Thereafter you can see genitofemoral nerve is traversing downwards. So this is, I am just using yellow color to show, it is traversing over the psoas major muscle, and it is giving two aspects, it is giving two branches, as you can see here like this. So one is the femoral, another is the genital. Okay. So efferent signal to cremaster is given by, see here, it is given by the genital, which is supplying the cremaster muscle. But when we are talking about the afferent is the femoral branch. So this is important. So write down, afferent of cremaster reflex is via femoral branch of genitofemoral nerve, basically, along with close to it, along with ilioinguinal nerve also, but in the question the efferent was asked, and the efferent is traversed by genital branch of genitofemoral nerve, which is giving innervation to cremaster muscle. So got it? So we have done with this. So is it okay, everyone? We have got the correct answer, and the efferent limb of cremaster muscle is clearly genitofemoral nerve. Now let's move on to the third MCQ, third clinical MCQs. So I will read the MCQ for you. A 34-year-old man is undergoing an emergency appendectomy operation. After the appendectomy has been performed successfully, the patient undergoes exploratory laparoscopy. Which of the following anatomical features are most useful to distinguish the jejunum from that of ileum? So 5 options are there. Jejunum has thinner walls compared with the ileum. Jejunum has lesser mesenteric fat compared with the ileum. Jejunum has more numerous vascular arcades compared with the ileum. Jejunum has more numerous lymphatic follicles beneath the mucosa compared to the ileum. Jejunum has few numbers of villi as compared with the ileum. So these are the options which is provided, and we have to approach for the correct answer. 5 options are there. So let's come up with the correct answer. So actually that means we have to identify the correct point, which is exactly when we see the jejunum and ileum loop. Okay, while performing the operation, we can clearly differentiate it. So for correct option for this MCQ is C, that is jejunum has B. Jejunum has lesser mesenteric fat compared to ileum. The correct answer is B. So jejunum will have less fat. If you see the loops and the mesentery of jejunum and ileum, you can clearly see the fat content of the jejunum will be less as compared to that of ileum. So we have got many points of difference between the jejunum and ileum, but the one which is very easily identifiable, we can easily identify when the operation has been performed, is the content of fat. So see here. So let's rule out all the options. Jejunum has thinner walls compared to ileum. It's wrong option because jejunum has got, this is not right because jejunum has got, the wall is actually a thick wall. It is having a thick wall. So this is the wrong option. Jejunum has mesenteric fats less. It is absolutely correct. Jejunum has more vascular arcades. Absolutely wrong. Actually, jejunum has got 1 or 2 vascular arcades and ileum has got 3 to 5 vascular arcades. So less number. So this is also wrong. Jejunum has got numerous lymphatic follicles. So if we see, the lymphatic follicles number is more in the case of ileum, and that is also called as Pierce patches, and on naked eye we can't see these features. Also, if we talk about the villi, more villi are there in jejunum. It is also wrong. When we talk about the villi, there is more villi in the jejunum, so this option is also wrong. But the most characteristic feature and easily distinguished part between jejunum and ileum is that the jejunum is having less mesenteric fat. So yes, there are many differences, but the differences, for example, the differences like villi, the differences like wall thickness, the differences like lumen, the differences like pellicus circularis, because jejunum is having more pellicus circularis. So these kind of differences is not readily seen. So what is more easily to seen is the fat. So fat content will be less in case of jejunum. So my dear aspirants, see here. So let me explain these point. Can you see? So these are one or two arterial arcades which is giving branch to jejunum, and there is 4 to 5 arterial arcades which is giving branch to ileum, and that is giving vasa recta. What do you mean by the straight arteries which is going towards the intestinal loop is called as the vasa recta, as mentioned here. Now what you can appreciate, the fat contents, so I am using yellow color, so this is the peritoneal window. So you can see more space is there in the peritoneal window, but if you will see the peritoneal window of the ileum, it is more closely attached, so that peritoneal window and less fat will be seen in that of the jejunum as compared to that of ileum. Arterial arcades are 4 to 5 in case of ileum, but 1 or 2 in case of jejunum. Also there is pellicus circularis. If you will see, this is the circular fold. So pellicus circularis is closely set and it is more in number in case of jejunum, and less pellicus circularis are there, and space is more in the pellicus circularis as we go for ileum. Also the Pierce patches. What do you mean by the word Pierce patches? So when we are talking about Pierce patches, that means lymphatic aggregation. Okay, so Pierce patches and lymphatic aggregation is more in case of ileum, but that is a histological features and we can't see it with the naked eye. So this is the difference, and so we have to mark the correct answer, and here the correct option in this MCQ will be definitely B. So is it okay everyone? So B is absolutely correct answer. Yes. Now coming to question number 4. A 44-year-old man is admitted to the emergency department with excessive vomiting and dehydration. Radiological image demonstrate the part of bowel is being compressed between the abdominal aorta and the superior mesenteric artery. The so-called nutcracker syndrome. Which of the following intestinal structure is most likely to be compressed? Second part of duodenum, the transverse colon, the third part of the duodenum, the first part of the duodenum, or the jejunum. So see here, 5 options are there and you have to mark the correct answer. So in this case, actually, nutcracker syndrome. What do you mean by nutcracker syndrome? I will show you a diagram. Actually, what happens, the abdominal aorta and the superior mesenteric artery, exactly the third part of the duodenum is the correct answer, because the third part of the duodenum take a path which is exactly situated anterior to abdominal aorta and in between abdominal aorta and that of superior mesenteric artery. So there can be the chance of compression of third part of duodenum. So this is the correct answer. I would also like to rule out the incorrect option. So firstly, write on the correct one. Third part of duodenum takes a path situated anterior to abdominal aorta and inferior to the ventral branch of abdominal aorta. It is lying inferior to the ventral branch of abdominal aorta. What does that mean? That means the third part of duodenum is exactly sandwiched between two important structures. One is the abdominal aorta and the other is the superior mesenteric artery. Actually, superior mesenteric artery is one of the ventral branches. In case of abdominal aorta, there are 3 ventral branches: celiac trunk at the level of T1, superior mesenteric artery at the level of L1, lumbar vertebrae, and inferior mesenteric artery at the level of L3. So, exactly the third part of duodenum can get at times compressed between these two structures, and that is exactly what is asked in this MCQ. Okay, is it clear everyone? So, what I also want to rule out the other option which is not correct. Okay, so we have got, so exactly the third part of duodenum is lying in an angle sandwiched between these two important structures, abdominal aorta and that of superior mesenteric artery. So, it is the chance that third part of duodenum can be compressed, and this is exactly, I will show you a diagram for it. So, we have got C as the correct option. What about the other? The other options are second part of the duodenum. Second part of duodenum is not the correct answer, and it is less chance that it can get compressed. Why? The reason is that second part of duodenum is lying parallel to that of, it is lying exactly parallel and to the right side of abdominal aorta. So, less chances that it will compress. Transverse colon. When we are talking about transverse colon, actually transverse colon part is horizontal pathway. So, it is lying horizontal, it is running horizontally in the abdominal cavity. So, less chance to get compressed. Third part we have already discussed, it is correct. First part, actually first part only continues, it starts from the pylorus part of the stomach. So, it is just starting where the pylorus part of the stomach ends, and from here it continues into the second part, and it is also not exactly lying in between the abdominal aorta and the superior mesenteric artery. Jejunum again can't be the correct answer. The reason as why jejunum is not the correct answer, it's a part of the small intestine after the duodenum where the jejunal branches of superior mesenteric arteries are given. So, jejunal branches of superior mesenteric arteries are traversed through this, and it is also less chance that it can get compressed. So, the most important answer and the correct answer is the third part of duodenum, which can get sandwiched between, because it is lying exactly in an angle between the abdominal aorta and superior mesenteric artery. So, okay, the next important point is that you can appreciate this relation once you see this diagram. So, let me show you. This is the stomach, and this is the first part, this is the second part, and this is the third part, which is our correct answer. Okay. So, clearly you are seeing this is the third part. So, what you can appreciate, the third part of duodenum which is compressed here, the third part of duodenum is compressed here, and exactly its compression is showing, it is compressed by which structure which is shown in the diagram, it is compressed by the superior mesenteric artery. So, clearly we can appreciate the duodenal compression is between superior mesenteric artery which is shown in the diagram, and posteriorly what structure is lying? Abdominal aorta. So, clearly you can appreciate this is the duodenal loop, third part, which is getting compressed between two important arteries. This is the superior mesenteric artery, and that of posteriorly it is having the abdominal aorta, AA. So, clear? Now, let us move on to the next. So, let us move on to the next MCQ, that is MCQ number 5th. During a laparoscopic cholecystectomy done on 61-year-old man, which of the following arteries must be clamped to remove the gallbladder safely? Whether the artery is common hepatic artery, proper hepatic artery, right hepatic artery, left hepatic artery, or that of cystic artery. So, my dear aspirants, what is the blood supply of gallbladder? Any idea? You all can write your answers in the message. So, actually the blood supply is via cystic artery. So, it is important for us to know characteristically this is the correct answer, that is the cystic artery, because cystic artery has to be clamped because it is the blood supply for the gallbladder. Cystic artery is a branch from right hepatic artery, and we know that actually this sequence which is given above are the, so we know that why these above can't be the correct answer. The reason is all these options can't be the correct answer. The reason is that we know that common hepatic artery is a direct branch from celiac trunk. Then it gives proper hepatic artery is a branch from common hepatic artery, and then it gives two branches, that is the right and the left. And again the right hepatic artery will traverse along the gallbladder, and the artery is cystic artery, which is giving the blood supply to gallbladder. So during this laparoscopic cholecystectomy, which has to be performed, the artery to be clamped is the cystic artery. Okay. So this can be shown in this diagram. This is the abdominal aorta. Okay. At the level of one of the ventral branch of abdominal aorta, which is given at the level of T12, is the CT. Which branch is this? So this source is CT, I have written here. This is the celiac trunk. CT means celiac trunk. Now here in the diagram you can see the three direct branches. The splenic artery is a direct branch. The common hepatic artery is a direct branch. Okay. So we have also got, this is the splenic artery and this is the common hepatic artery, and this will be the left gastric artery. So this is the three direct branches. Now common hepatic artery is giving proper hepatic artery, and my dear aspirants, the proper hepatic artery is giving left hepatic artery and is giving the right hepatic artery, which can be seen in this. It is giving left hepatic artery and the right hepatic artery, and a branch from the right hepatic artery is the cystic artery, which is giving blood supply to the structure, that is the gallbladder. So we have got the correct answer as the cystic artery. Okay, so the pathway is like this, the pathway will be like this. So we have done with this, and we have seen this whole tree here. Exactly, this is a very clear diagram. So the source is like this: abdominal aorta, giving the branch celiac trunk, giving the branch common hepatic artery, giving the branch right hepatic artery, and right hepatic artery, it also gives left right hepatic artery, giving the branch cystic artery, which is supplying the gallbladder. Actually this hepatic artery is giving blood supply to liver, biliary passage and the gallbladder. Okay. So now, before ending the session, I would like to tell you about my free live sessions on the Unacademy platform. I always come up with free live sessions on the Unacademy platform. So for this, you have to download the Unacademy app. You have to find your goal as NEET PG. So you will find your goal as the NEET PG, and then either you can go directly to the link of my session, or you can, if you want to see the session of other educator also, you can use my code ANAT10, unlock the session and participate in free session, which will be highly beneficial for you. The benefits have already been shown, and every Wednesday I come up with many free sessions. So one is 1 or 2 free sessions are there every Wednesday. So do join me for the free session. Okay. I also want to tell you about the NEET PG Compact. Before ending the session, once more I want to tell that those students who are interested for preparing for NEET PG INICET, just go for Iconic or can take Plus subscription. They can use my code ANAT10 for 10% discount. I would also like to remind you about NEET PG Compact test. The date is 10th October. The timing is 11 AM. 60 minutes. 45 MCQs, all the best. Scholarship from a pool of 1 crore rupees, and first 200 rankers will definitely get the scholarship. All the best, keep studying. Thank you so much. Thank you.